welcome to the next episode of Beyond the Couch, being filmed live at the Irish Hypnotherapy Conference. Going to bring to you a psychotherapist this time called Cristodora. And she's going to talk to us about her work with trauma and how she can help trauma clients. So, Chrisidora, over to you.
Yes. First of all, we need to clarify that trauma is not necessarily something very big that happened to us. But trauma can be anything. Trauma can be a baby left alone, sleeping while mama is cooking, and that baby being awake and realizing mama is not there and feel that abandonment. And that is a trauma as well. A trauma can be just an innocent comment that a parent doesn't realize it might affect that child. And that it's a trauma as well. Trauma is also an injury, an accident, a surgery, and not just specific events like a violation, like an accident, like a death. Like that's what we normally associate trauma with.
Yeah, trauma is normally associated with something major.
Exactly.
But it doesn't have to be.
Exactly. So, so you have an idea. A person who's afraid of heights. It's a person that might have been in their mother's womb and the mother has fallen off while she was pregnant, and the baby would be born with that fear of falling. Okay. So trauma is not necessarily something direct. We can experience it indirectly. So if there is a traumatic event happening in my environment and I just mirror that environment, especially if I'm under 7, when I'm just like a sponge and subconsciously I absorb everything. So everything can become a trauma. And it was important to start mentioning this because, as I said, most of us, when we hear trauma, we have this idea, oh, it has to be something
It's big, it's major, yes.
Huge, yes. So I've been developing my work with trauma, first of all, from my own experience, which was really traumatic from the beginning of my life. Yeah. And then I started with psychology, with CBT, with transactional analysis, with psychoanalysis, and then I realized it's not moving forward. Like people can actually stay and get in the wheel of the hamster, right? And saying the same story over and over. And the cognitive mind is very good at that. And then I discovered hypnotherapy, but not that hypnosis that we learn in university, some Ericksonian metaphors, and that's it. We learn how to actually deal with subconscious mind, and we mostly learn parts and regressive work. Parts therapy is very good to deal with traumatic events and do an integration. But then with time, I discovered as well EMDR, BLS, brain spotting, WANA integration. And when I discovered these tools, which are mostly physiological, it helped me to actually help the person to release the trauma in half an hour. Yeah. Then there is a re-education process, right? So the person has been used to living away for a long time. So once that trauma is processed and integrated, then what we need to do next is to help the person integrate a new behavior. Yeah.
And so that all gets done as hypnotherapy, or do you bring both worlds together as a cognitive and hypnotherapeutic?
Exactly. So how would the setup go when talking about mixing hypnotherapy with EFT, which is very psychosomatic, with BLS, is that of course, like hypnotherapists will first get a good anamnesis. We don't need to know the entire story. No. We don't need a person to tell us the entire thing because that's what they've done their entire life. Everything we need to know is the basic emotion, the basic behavior that they want to change, what they want to change it into or for, where they feel it in their body, and that's it. And then we do the normal hypnotic process using the resources that we have, like elements or fast or slow inductions. And we start working with the brain. So we have two hemispheres, left and right. Yep. And traditionally we know that left is logic and right is emotional. But then both of them, as Jill Boyd is saying, they also have their emotionality. So left hemisphere is also emotional, and right hemisphere it's also logical. So I discovered a method that helps integrate the information that has been stuck in one of the brains through one eye integration. That means that we cover one eye, we cover the other eye, and we notice how the person actually feels differently and thinks differently when they connect with it. So I'll give you an example. A person who has a, you give me an example.
So a person that's has a fear of being on their own.
Has
Possibly.
a fear to being on their own. Okay, so we get the signs, we get the feeling where they feel it in their body, okay? And then what we do is to have that person cover one eye, right? And ask what they think, feel, perceive when they evoke that state or that thought, that image, right? And the person will cover one eye, the eye has to be open, right? And they will process that information different in one brain hemisphere, in one of the brains than on the other. Normally one of them is very emotional and it connects the person even more with the feeling, and it can even increase the feeling. And the other one will say like, well, it's okay to be on your own. There's no problem, you know? So when the person realizes that, like, shit, one part of me says, and here is the beautiful parts work, but from a biological perspective, because when we do this exercise, what we're actually helping the person is to be convinced that it's actually working. Because it's physiological. It's the person that is giving us the information. We don't have to put in information in them. So that's the first thing, like, oh, in one hemisphere, I feel much more distressed. In the other hemisphere, I feel calmer. What's going on in here? What happens is that we have something called corpus callosum in between both brain hemispheres, and before 7 is not developed. That's why everything that happens before 7, it's stuck or stays in our right hemisphere. As we're growing between 5 to 8 years, this bridge starts to finish its development, and we start to get information from a side to another. That's why normally it's when children stop believing in Santa Claus. Oh, I know, Papa, I know it's you. It's not, you know? So that's when we start to move the information from an hemisphere to another. And that is why also most traumatic events are before 7 years.
7,
Before 7 or 8 years old. So what happens when, as an adult, there is a very traumatic event, right? When we are children is normal because that corpus callosum is not developed. So we need to work with hypnosis and one eye integration and any other kind of therapy setup that we use to help make that integration, help make that, create that artificial bridge in between our brains. But what happens when we talk about an adult? When we talk about an adult, see, if an adult doesn't have the resources to be able to deal with a very severe news, for example, they just found out that their wife died in a car crash, a car accident, right? What happens? The person will feel a shock. Their nervous system, their limbic system, their amygdala will just shut off, and they will not be able to think. As they will not be able to think, and most of the therapists understand the process, they will not have the possibility to process that information into their neocortex. So that's how trauma is stuck in the right hemisphere.
It's kind of that there, something happened, and people explain it. I don't know what happened, I just went onto autopilot.
Exactly.
And it's our thinking shutting down, our survival system kicking in, making us do what we need to do.
Exactly.
And slowly it comes back in, but it doesn't get processed.
Exactly, exactly. So the brain integration really helps in the parts therapy process and also in the regressive process, because when I am connected with my resourceful part and I realize that that part is inside of me and no one has to come and give me the resources, very little. Me as therapist, I go and educate the people about how they need to reframe, because most of the times the resources are in their left hemisphere or one of the brains, because sometimes people are crossed, right? So we don't want to tag it.
It's still a little bit, neuroscience is still not 100%.
Debating. They're debating a lot on it.
So actually, clients will come to you for, mainly on the trauma. As you say, a lot of it starts So before 7, I saw somewhere, maybe you can verify this, that between the ages of 4 and 7, our memories get completely wiped. So by the time we're 7, we don't remember anything before 4, because our brain is so active, and so the stuff that happens actually gets locked in as a behavioural normal, rather than just as a, which is why we can't remember why things happened. It's just locked in as a normal.
Consciously, we cannot remember.
Yeah.
However, unconsciously, when
subconsciously,
exactly.
Unfortunately, we can't communicate with the subconscious.
Exactly.
We need us to do that for you.
Hypnotherapy.
So, how can people get in touch with you if they want to learn more about your work, if they want to learn from you, or if they just want to come and see you?
Yes, you see, I'm an in-person person. I like to be in person. I go to conferences, to conventions. And recently I created a English website. So cool. It's Cristodora Buiculescu, my family name.
I will stick the spelling in.
Yeah. It's tricky. Yeah. So it's Cristodorabuiculescu.com. That's where I have the website, and that's where they can send their inquiries, and I can answer to any other questions that they might have about how to deal effectively with trauma. And you see, I go to many conventions and I start to have this kind of nickname, like the demo lady, because I like to show all that theory, because it's lots of theory. You need to stay like 1 or 2 years learning, but then you see it in action. So you see a person in 20 minutes going from a 10 of SUDS to a 0 of SUDS, and making a beautiful integration on the spot. So, but I'm saying it doesn't mean that, we do one session and we fix the thing. I want to make sure, because I know there are a lot of people who are selling, just one session to fix one thing. It is possible that one session, it's enough to unlock something, but then it's an entire re-educational program. So normally you can work
and those who are watching,
in processes.
You can fix things in one session, but please book the client in for the second one so you can check your work.
Exactly.
There's so many people I fix a lot in one, but you need second session to check your work.
Exactly. I normally promote transformational processes. So I have some issue, I fix these issues, and now what? So then I with coaching, obviously, I accompany people to create new goals, new objectives. I teach them how to do self-EFT, how to do self-hypnosis, how to do self-one-eye integration. So then later on, when they are in front of similar situations, they can work them out on the spot. And we avoid them being re-traumatized by new events.
And I love that, because it's really, really important that we give our clients the tools. Because what we do is no great secret. We don't have special powers. We just know the tools that will help. And to teach, I say that the EFT is a very simple process. Psychosensory touches can really help reduce stress, anxiety. And remember, trauma doesn't have to have a capital T.
Exactly.
It can be something really small, but tiny things can grow and grow and grow.
Yes, exactly. Roll like what do you say, like a
it's like a snowball effect. Just
snowball,
pick it up.
Exactly.
Pick it up,
So that's one thing. And then I just started training. I was very shy with the idea of training in English. I train in Spain. We already have an academy in Spain. It's called Mindset Pro Academy. And we've been training for like 5-6 years now. However, because as you can realize, English is not my first language. So sometimes I stumble over my words, and I had to do this internal work of like, it's okay. You don't have to know everything. So I recently launched this website to promote the training. So I'm teaching people how to use the tool. And most importantly, I wanted to let people know that when they work in this fast and effective way, in fact, their clients are loving them so much in a way that they are recommending them even more. I have a 2 months waiting list.
Wow.
I have a 2 months waiting list, and the reason why that happens is because I work with people in a fast, effective manner, not fast like McDonald's kind of way, fast, integrative, leaving them with resources, very important, so they don't just tomorrow are again in a new situation and you know.
Yeah, it's not a fixed and go, it's a fixed and here's the toolkit to take with you.
It's a transformative process.
So,
yeah.
Well, that's mate. I'll put all those links in at the bottom.
Yes.
Thank you very much for your time. It's been educational. I hadn't heard of the one eye over the other.
Yeah.
So, no, never heard that one
We'll
before.
see you in the training. It starts 9th of May.
9th of May. Is it online or is it in person?
Everything is online, and the time frame it's set up in a way that everyone can reach out, even from United States.
Cool.
So, yeah.
Yeah, excellent. I will look that up when I get back. So, Chrisidora, thank you very much for your time. It's been very informative. Remember, if you like what you're seeing, hit that subscribe button down below, and all the other information will be at the bottom of this too. So, thank you so much for your time.
And keep loving the world.
Yeah, exactly. And keep loving the work.
Yes.
Perfect.
All right.
Thank
awesome.
you. Great. Perfect.
Very good.
Good.